stressful.
Try mics. Check two. Okay, so what you guys need to do is bring your mic down and just put it between you and just lean into it when you're gonna talk.
Okay.
Okay, let me hear it.
I mean, you can hear me.
Yes. 2, 3.
Test.
There you go.
Test. Talk across, in.
Can you hear me, Steve?
I cannot.
I don't think I can.
Can you hear me? Oh, yeah, you hear me?
I can't hear you.
That's as high as this thing goes. Just move. I went higher than that. Shitty. It really is shitty. It's a lot of really cheap.
Oh, I brought the fun little thing for you to see, Scott.
The fun little thing.
Excuse me?
Fun little thing is that?
Can I see?
The roadie.
Yeah, don't show him, then he'll want to see yours. Okay.
Sorry, I just stole your water.
It's fine.
Boy germs.
There we go.
All the air.
All right.
Hello?
Howdy. Yeah.
He'll be coming down from Jersey when he comes. He'll be coming down from Jersey when he comes. He'll be coming down from Jersey. He'll be coming down from Jersey. He'll be coming down from Jersey when.
Hi guys, it's Stacy DeLoach. I just want to call in and say hey.
Stacy DeLoach.
Has a pretty nice cock, and I think about it every day.
Stacy DeLoach.
Has a mighty nice cock, and I'd like to ask it out to play. His glands are so luscious and huge, he had his hand of foreskin meat refined.
Stacy DeLoach.
Has a pretty nice cock, someday I'm gonna make it mine, oh yeah.
equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I page Dr. Steve.
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, and the longest-running show on this channel. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider, who gives me street cred with the whack alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
We also have in the studio Tacey, my partner in all things. Hello, Tacey.
Hello.
And we have DNP Carissa back from sabbatical. Hello, Carissa.
Hello.
Behind me, surprise guest, Stacy DeLoach, everyone. And Shawn P. No, we have our special guest, Shawn P. from New Jersey. Everyone's going, who the F is Shawn P? Exactly.
Yes.
But we will answer that question. Hello, Shawn.
Hello.
Glad to have you here.
Good to be here.
This is a show for people who never listened to a medical show on the radio. Don't forget, we are not your medical providers. If you can't find an answer anywhere else, you can give us a call at 347-766-4323. That's 347.
Pooh head.
But most importantly, we're not your medical providers. Very good, Shawn. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, or whatever. Don't forget to check out Dr. Scott's website at simplyherbals.net, simplyherbals.net. Home of the best CBD nasal spray ever made, I think, actually ever made.
Ever made.
So there you go. And so we have some jingles here. These are terrible. And this is Shawn's jingle that Scott and I have been messing around with. And it's simply as awful. So we're going to get this bullshit out of the way, and then we'll get to the medical questions. Sorry about that. And so this is Myrtle.
He'll be coming down from Jersey when he comes. He'll be coming down from Jersey when he comes. He'll be coming down from Jersey. He'll be coming down from Jersey. He'll be coming down from Jersey when he comes. He'll bring them Taylor pork rolls when he comes. They're good eating. Bring old Taylor pork rolls when he comes. Them's good victuals. He'll be bringing Taylor pork rolls. He'll be bringing Taylor pork rolls. I think they call them ham rolls when they come. He'll be bringing good old Snooky when he comes. He'll be bringing good.
By the way, there's 47 seconds left in this. So
Old Snooky when he comes, she's right purty. He'll be bringing good old Snooky. She's got big old titties, but he'll bring old Snooky when he comes. He'll be bringing Boardwalk Fun Girls when he comes. I thought that's what Snooky was. Ain't she a Boardwalk Fun Girl? Well. He'll be bringing Boardwalk Fun Girls. He'll be bringing Boardwalk Fun Girls. He'll be bringing Boardwalk Fun Girls when he comes. That good old Shawn, he surely is a good, he's a good feller, I'll tell you that. He surely is, and that's a fact.
Amazing. Good stuff.
all right.
I know it's going to surprise everybody when we tell them we just kind of came up with that on the spot.
Well, yeah,
It's shocking, isn't it?
Yeah.
There wasn't a lot of planning that went into that.
No planning, no studio time, no mixing, no editing, no nothing.
Nope.
Just pure bullshit.
You'd never know.
I do have a Stacy DeLoach.
I love
Now, we did one
We did.
where you did good old Stacy DeLoach. And then I had this thing that was a Sam Roberts song that was about his foreskin. And it was to the tune of Her Majesty's Pretty Nice Chick or whatever it is, the Beatles song.
Oh, gotcha.
Right? Okay.
Gotcha.
But we converted it into a Stacy DeLoach song. So here we go. Stacy DeLoach.
Has a pretty nice cock, and I think about it every day.
Stacy DeLoach.
Has a mighty nice cock, and I'd like to ask it out to play. His glands are so luscious and huge, he had his hand of foreskin meat refined.
Stacy DeLoach.
Has a pretty nice cock, someday I'm gonna make it mine, oh yeah, someday I'm gonna make it mine.
So there you go. There's the Stacy.
Well, that's because you're an idiot.
You see? You're stupid minds. Stupid.
He's a fucking idiot.
You get nothing. You lose.
So anyway, Yeah, stick to medicine, Doc. I get it. Anyway, so welcome to Shawn and Stacy into the studio. Shawn, you've been listening to Ron and Fez back when it was ronandfez.net, right?
Sure.
So you've been part of this sort of universe for quite some time, and then it split off into all these multiple weird little corners of the universe. Howard Stern listener too?
No, not really.
Oh, really?
It was more O&A, Ron and Fez.
Okay, all right. Because you could do both, because Howard
absolutely.
Stern was in the morning and Ron and Fez in the evening, and then Opie and Anthony in the middle of the day or in the afternoons. So there is the Dabble verse, there's the Hack verse, there's, I don't know, whatever this thing is. I mean, we're part of the O&A universe still, I guess, but very peripherally. Did you hear that Tukey had, who is Bedabbler, had Wendy, the slow adult, on his show for 2 hours today.
I did not.
It was amazing. So everyone should go,
have to go check that
and
out.
find that. Tukey is his puppet character.
I'm a huge fan of Tukey.
And Tukey is hilarious and brilliant and, yeah, very exciting. So anyway, that's for the people who have no idea what we're talking about. We will do Tacey's topic time and stuff now. Are you ready, Tace?
I sure am.
All right.
Cool.
It's Tacey's time of topics. A time for Tacey to discuss topics of the day. Not to be confused with Topic Time with Harrison Young, which is copyrighted by Harrison Young and Area 58 Public Access. And now, here's Tacey.
So I don't know how to say this word. Oh, I'm sorry. Hello, everyone.
Hello.
So I don't know how to say this word, but Stacy DeLoach brought it up, and he's been taking it. And so we decided that we were going to look up and see if we could find any scientific evidence.
Right, and remind me what it has a weird name.
Shilajit.
Shilajit.
Yeah, Sheila. Yeah, and we thought he was saying Sheila E.
Yeah, we thought it was saying Sheila E.
Shilajit.
Yeah.
I have it out on the bike.
Okay. So.
Wait, did you say something? Okay.
I found an article.
Okay, I'm getting confused. Okay,
and it's a natural substance found in the Himalayas.
But they scrape it off of rocks or something, right?
Formed for centuries by the gradual decomposition of certain plants by the action of microorganisms. It restores the energetic balance and potentially able to prevent several diseases.
Okay.
Recent investigations point to an interesting
that was
medical
quite a bold statement, by the way.
application toward the control of cognitive disorders associated with aging and cognitive stimulation. Fulvic acid, the main active principle, blocks tau, T-A-U?
Tau.
Tau. Self-aggregation, opening an avenue toward the study of Alzheimer's therapy.
What?
Considering the expected impact of that word, I can't say, usage in the medical field.
What, Shilajit?
No, Shilajit.
Oh.
Especially in the neurological sciences, more investigations at the basic biological level as well as clinical trials are necessary.
Okay, so let me interject something here. It is true in the Journal of Alzheimer's Disease from 2011, there was an article that said fulvic acid inhibits aggregation and promotes disassembly of tau fibrils associated with Alzheimer's disease. So that's a target. Why do we have to scrape shit off of rocks in the Himalayas? Just leave the Himalayas alone. We can synthesize fulvic acid in the lab. You know, yes, it looks like the Shilajit stuff is high in fulvic acid. So let's just use fulvic acid. Do we have to make a trip to?
What if there's something else that's part of that that they haven't found or researched or studied yet?
So how would you design a study, Dr. Scott, to determine whether Shilajit versus fulvic acid synthesized in the lab was superior?
Well, I know the correct answer is a double-blind study where you have a control group. Yep, we have a control group that doesn't get anything.
Okay,
and then you have one that gets the fulvic acid.
Yes,
and then one that gets the sanjit.
Okay, very good.
Give thyself a bell.
So far,
for fuck's sake.
So far, so good.
One.
Now.
So,
that was easy.
And then what would you do with it? All DNP Carissa? You said that was easy. Let's do let's design. Who do we pick for the study, and how do we design it?
I have no idea.
Oh, yes, you do. She's the researcher.
Lying
She does
ass.
too. She's just lying.
I don't lie.
She's sassy today.
Anybody want
That
to
is
throw in?
true.
Because Scott can just take it.
Take it away, Scott. Get some more bells.
Take it away. Well, I think you have to have a very broad group of subjects.
headphones, don't
Correct.
And you can't just pick some based on numbers that you want to be.
Well, that's right. It needs to be a representative sample
of a group.
Across
broad
all
group,
demographics.
Thank
What?
you. Ooh, okay.
Oh no, hell! You can't steal my bell.
Now, because if you only do it in women who are 40 years old, then when you bring it to market, you can only market it to women that are 40 years old. There was a, I can't remember what drug it was that had not been studied in women for whatever reason, and when they marketed it, they said they could only market it to men, even though there was no reason it shouldn't have worked.
Viagra?
I can't remember what the Viagra. Well, that would be a good example, but that would actually probably make sense. But anyway, go ahead. So we get across demographics, and then what do we do?
Well, first you give a very small dose to see if there's going to be any kind of really bad side effects.
Correct.
Number one. Number two, when you see that there are no terrible side effects, then you start branching out and adding people to the study.
Yep.
And giving them more of the dose, and then you have to pick a target dose.
Correct.
You have to pick a target dose. You can't just say, well, just take however much you want.
And what else do you have to pick? You have to, before you even start this thing, you have to pick something. I'll give somebody a bell for this one if they can think of
Pick
it.
something.
Well, you already said that. You already said the dosage.
Delivery dose.
The delivery of it.
The pay people. Yeah. And how are you going to give it to them?
Well, okay, you gotta say what the outcome is. What are you measuring?
Oh, what are you measuring?
Because you can't just say, well, we're going to give it to people. Does it? People will ask me, does this supplement work? And it's like, well, for what? People ask me, does vitamin D work? And it's like, well, do you want to prevent rickets? Works pretty damn good.
Yeah.
You want to prevent cancer? We don't really have good data on that.
And here's a question about that, Dr. Sleep. Talking about just this tau protein. So and you're able to check the tau proteins in normal blood panels.
No, I think you're going to see those in brain tissue.
Well, that was going to be my concern. Is that if our end goal is to help lower the risk of Alzheimer's and the outcomes, you want people to have less brain lesions associated with these tau proteins.
Right.
It's,
So you could
really
look
long
at,
study.
You could look at the fibrils.
Okay.
By doing brain biopsies.
Right. Well,
But do we really care what it does to fibrils? What we really care is, does it prevent or delay the onset of dementia?
Especially slowing the onset.
So I don't think you have to look
progression.
at the fibrils. You know it does it.
Yeah.
And they've shown that it does it in vivo. In other words, they've given it to animals and they've shown that it works to mess with the fibrils. Now, if you've proven it's safe, you give it to these 3 cohorts, one that's getting a placebo for 10 years or 5 years, one that's getting the Shilajit for 5 years, and one that gets the fulvic acid for 5 years. Is there a statistically significant difference in adverse effects, but in our primary outcome, which is onset of dementia? Now you got to figure out, how do you measure that? So you have to have a validated tool where you get people to add numbers together and spell things backward and forward. I'll give you a little. Let's do this with Shawn since he's the guest.
Oh, Shawn, yeah, he's a smart one.
One of the tests they'll do for scratch pad memory is, I'm going to say three words and then you say them back to me.
Okay.
But wait till I'm done. Apple, table, penny.
Apple, table, penny.
Very good. Now, spell world.
WORLD.
Now spell it backward.
Oh, jeez. DLORW.
Is that right?
I think so.
No.
I think so.
W-O-R-O-W.
R-O-W.
Close enough.
Oh, boo.
He's a fucking idiot. He's a fucking idiot.
But anyway, okay.
Don't
Now,
worry, it's going to get worse.
now tell me those 3 objects.
Apple, table, penny.
There you go. So he's got intact scratch pad memory. So you give somebody... You don't. You couldn't. Well, you do this test all the time. That's the thing. If they do it with me, it's like, well, apple, table, penny. I'll just be saying that in the nursing facility. Apple, table, penny. Apple, table, penny. Apple, table, penny. Anyway, whether I have dementia or not. So so that shows intact scratch pad memory. You give somebody a word and then you distract them with something that takes their brain, and then can they come back and find that scratch pad? And
people with dementia have difficulty with that. The other thing that they have
a
difficulty
problem.
with.
My headphones, I can't hear shit in them. I don't know if it's the splitter or the headphones.
Okay. Well, thank you for grinding that to a stop so that you could hear. I'm just kidding.
I'm going to leave.
Talk
No,
about
don't
the
leave.
party pooper.
How's that? Is that better? It might be the splitter.
It's the splitter.
Okay. All right. We'll just stop and we'll fix it. Let me see the splitter.
You can probably hear without it.
I
Without
can hear
it,
fine.
Yeah. You can hear fine, yeah.
I'm good.
I don't think you need headsets,
I don't
Steve.
need it.
What do you do if I play a call?
She ain't gonna miss it.
It's fine. I'm not going to talk anyways today.
Yeah, you are.
Nope.
Okay, Shawn, can you hear?
I can.
Yeah.
Okay. All right, I got to get new splitters then. Sorry.
Damn it.
It's fine. I just didn't want to keep that shit on my head.
Yeah, no. Don't keep it on your head.
Mess
It's not
up your
working.
hair.
God, I know. My hair that I haven't washed in like 8 days. It's fine. Hi, nice to meet you. I don't wash my hair.
It's okay.
Sorry to cause an interruption.
Okay. The other thing that people with dementia have difficulty with is naming things. We've talked about this before, but this is a wristwatch. This is a pen. Some people with dementia have what's called anomia, where they have difficulty naming things, and they will say, well, that's something that you write with. And this is something you tell time with. I had a professor, Newton Fisher, and he was a genius. He had an IQ of out of this world. I know it doesn't go up to 220 on certain scales, but I mean, if the top was 200, he'd be 215.
Right on.
And when he got some dementia, I remember hearing him describe a deck of cards as a concentric stack of thin laminates. Now, only a genius would, in their early dementia, use anomia, or in their anomia, use it that way.
Wow,
he was amazing. Amazing guy. But anyway, all right. So yeah, that's what you would do, and then at the end, you've got to have some standardized test. It could be the mini mental status exam, and you would say, people, the top score is 30. People who took the fulvic acid scored a 30. People with Silagit scored a 30. And people who took the placebo scored a 28. Well, then if your cohort is large enough, you could say whether that's statistically significant or not.
Right.
And then you could make a claim that fulvic acid does not appear to be inferior to Shilajit or Shilajit in dementia prevention, but both of them seem to have some effect that's statistically significant. Now, if the fulvic acid they score 27 and the placebo scores a 25, but the Shilajit scores a 28 and it's statistically significant, then you might say, just as Dr. Scott said, there might be something else in there in these scrapings from Himalayan rocks that we don't know. Now, how would you figure out what that is?
I guess do a full spectrum chromatography and break it down.
Okay, I'm going to have to give you a bell for that.
Give thyself a bell.
I'm going to have to start paying attention.
That is. Tasty's on her phone.
Tasty's down to one.
But yeah, you would
try to tease out whatever else it might be.
We used to do liquid chromatography when I worked in immunology, and you would put these groups of molecules in a liquid chromatograph, and when the spike came out, you would grab samples, and those were isolated molecules, and then you could inject those back in. And say you come out with 10 spikes. You inject those back in or give them orally or whatever, and you see which one actually had an effect. Then you drill down and see what the hell is that.
Right.
And then that's how you can discover new compounds that way, too. If you've got something like this that's, it's full of dirt and people's footsteps and rubber from their boots, but it also has
bird poop and flying over.
Yeah, it's got everything in it. So you got
stuff.
Yeah.
Hey, you just never know what's going to make it work.
Yeah.
You never know.
Yeah. So anyway, very interesting. Okay, that's a good one, Taste.
Good one, Taste.
Okay. Well, apparently, they actually, in Nepal and north of India, children take it with milk in their breakfast.
Okay.
So, and it also talks about how most of the studies are done in India, so there's a lot of room for
What are you saying? No,
The vast majority of
really
published
good. Of course
papers on
there
this theme are from India, leaving this sector of the planet.
There you go. That's
As an expert in their field, since this is a product that is extracted, marketing, and investigated in these latitudes. However,
that's right. The issue is that most of the studies, I'm assuming, are being done on that population.
this generates a segmentation of Shilajit, relegating it only to what has always been assumed, a natural product that is part of natural alternative medicine.
Correct.
And not as a result of medical and biotechnology innovation worldwide.
Well, which is okay.
So it's mainly just been studied in Eastern.
Right. So, but it's out there. I mean, I've got websites that are all over the place. So there'll be, what we ought to do is go to clinicaltrials.gov.
Let's buy some and try it.
And let's just see if.
Did you bring some? You got it on the bike?
Yeah, but it doesn't make you high or anything, though. Or give you a big boner. I don't want it.
Yeah.
Okay, let me see. Clinicaltrials.gov.
I think it's making Stacy suntanned.
Let's just go Shilajit. Shilajit. And let's see how many. Okay, here you go.
That shit stinks.
Really?
Oh, shit, it stinks.
It stinks?
Oh,
well, I can't imagine that it doesn't stink. I see 7 studies, and I don't see anything. Okay, use of an herbal preparation to prevent and dissolve kidney stones. And effective irritable bowel flares on serum PSA. Well, why would that come up?
I don't know, but I'll take it for all of the above.
Yeah,
especially if it has anything to do with the GOU.
I was going to say the G
blank.
word.
Don't say it.
Okay. Yeah, he's has been studied in 148 subjects. I'm guessing that has Shilajit in it, but I don't know. There's like 7 studies, so it's not insanely huge number of studies that are being done that are being funded by the NIH or whatever. So we'll see. Anyway, all right, very good. That's a good one. You got anything else, Taste?
Nope, that's all.
That's the whole everything. Okay,
good one, Taste.
All right, we'll get a bell for just
give thyself a bell
for showing up. That's a participation bell. Dang it. 2-2. Okay. You're right.
All right. Let's okay, enough of that.
Number one thing, don't take advice from some asshole on the radio.
All right. Here we go.
Hey, Dr. Steve.
Hey, man.
Jason from Louisiana.
Hey.
I'm going to try this one more time.
Okay.
I've heard of this medication on the radio that says it can help you stop drinking. It's called
naltrexone.
Naltrexone.
Yep.
I'm not going to stop drinking. I'm just curious of the validity of this medication.
Yeah. Okay.
If it can help you stop drinking, how would it do that?
Okay. That's an excellent question. Naltrexone, interesting stuff. Naltrexone was first studied as an opioid blocker. And the cool thing, there is naloxone and then there's naltrexone. Naloxone we use intravenously, but naltrexone you can take orally. And it will block the effect of opioids, but it does other things too. I had a family member that had pancreatic cancer, and he had horrible itching from the jaundice. It was the pancreatic tumor was blocking his bile duct, and he was very jaundiced. And he had this horrible itch. Well, knowing that the itch from jaundice is caused by stimulation of peripheral, in other words, out in the body, mu-opioid receptors, in other words, the receptors that are there to pick up signals from endogenous opioids, we call them endorphins, but also will pick up the signal from morphine. Well, they also will pick up the signal from circulating bilirubin, and it will cause itching. And when you give those people naltrexone, as long as they're not already on an opioid, then it makes the itching go away. And it was stunning, wasn't it, Tace? It was night and day.
That's pretty wild.
When he was taking the naltrexone, he was okay, and if he wasn't, he was just itching himself to death. So, but naltrexone, we use it in low dose in pain management. This is something Dr. Scott could use as an adjunct to his his practice. Low dose naltrexone in 4.5 milligram doses tends to suppress. This is the theory. The opioids that we make on our own, the endorphins, briefly, and then when its effect wears off, which is pretty quick, those endorphins come roaring back, and it's really good for chronic pain if you don't want to take opioids or other drugs.
Right.
And it's one of the safest drugs that we've got is this naltrexone. So that's one thing. But the other thing is that intramuscular extended release naltrexone is a medication that's approved by the Food and Drug Administration to treat not only opioid use disorder, but also alcohol use disorder, which is weird because alcohol doesn't stimulate the mu-opioid receptors. But naltrexone may suppress the the pleasure center of the brain that is triggered when you drink. And that's why it works. And it works amazingly well. I'm just looking here at SAMHSA.gov. Naltrexone is not an opioid. It's not addictive. Does not cause withdrawal symptoms when you stop it. It blocks the euphoric and sedative effects of opioids, and it binds and blocks opioid receptors and reduces opioid cravings. But anyway, now in alcohol, it says patients must not be physically dependent on alcohol or other substances. So what they mean by that is if you stop it, are you going to have rum fits, seizures, or DTs? They'll wait till after the alcohol detox process is done, when the patient has stopped drinking. This doesn't help you stop so much as it helps to keep you from drinking again. And it blocks, here we go. I'll give myself a bell on this. Blocks to endorphin receptors in the body, blocks the effects and feelings of alcohol. It reduces alcohol craving and the amount of alcohol consumed. Once a patient stops drinking, taking the naltrexone helps them maintain their sobriety. Yep.
I got a question about that. We use naltrexone a lot for opiate abuse, but a lot of times for the alcohol abuse, actually use the drug antabuse.
Well, sure.
Which is I thought he was going to be asking about that, which is a whole different.
Antabuse is. Did you ever see Clockwork Orange?
Sure.
The Ludovico technique, where they held his eyes open and showed him images of violence, and then. But they screwed up because they used Beethoven as the background music. Spoiler alert, the movie came out 30 years ago. But it has a profound impact on the ending of the movie.
Right.
But they were conditioning him against violence by giving him medications that made him sick to his stomach and throw up while keeping his eyes open so he couldn't avert his vision from violent images. So when he would see the problem with antabuse is you take it, all it does is if you drink, it makes you sick as well.
That makes you vomit, yeah.
And so it's that kind of conditioning. I don't know. I wish Liam were here because he knows what that's called. I don't know if that's operant conditioning or what kind of. Our son is the psychology, genius. But there's some sort of conditioning, but it's adverse conditioning. Whereas this it seems a little bit more gentle in the sense that it just reduces your craving for alcohol. It reduces the euphoric effect. So if you drink, you just go, this isn't doing me any good anymore. You could do both.
That's what I was going to ask you because
I don't know why they don't.
Well, I was,
or if they don't.
Well, I was wondering because I know of a friend that would benefit from some combination of medications. I think that. Because one of them is not working so well. And the one he uses is antabuse.
Oh, really?
Yeah, and it makes him violently ill. So he does, but if he doesn't take it, then he can still drink.
Yeah. Right,
it's a little different than what the naloxone would. And I was just wondering about putting those two together.
Okay, here we go. Naltrexone and disulfiram in patients with alcohol dependence. It says here 139 subjects. There were no relationship between the diagnosis of depression and medication treatment on alcohol use outcomes. Well, let me see. There was a significant interaction between diagnosis, medication group, and craving, where subjects with depression on disulfiram reported lower craving over time and subjects with depression on naltrexone. So I don't know. That's they're looking at them separately rather than together. The title is misleading. That's a good question. We'll have to look that one up. I'm not an addictionologist, so I don't
Well, we
deal with that very often. But anyway,
Interesting.
yeah.
Good question.
Anything that will help your sobriety, we're in favor of.
Shoot, yeah.
So and that guy was talking about not stopping drinking, and I'm pretty sure he called us from the highway. So I'm hoping that he's not drinking and driving. But anyway. All right, very good. Okay, here's one from.
Good morning, folks.
No.
Got a quick question for you. I had a little event this morning, threw up. That's a normal thing for me. Anyway, had a massive headache right after that. Made me start thinking, if I'm not mistaken, I don't think the brain itself feels pain.
Damn it.
Give thyself a bell.
That is correct.
Wow. The brain has nerve cells in it.
Sorry.
So, is it just the...
No, it's weird. The brain is nothing but nerve cells, but it doesn't have any sensory nerves in it. So when they do brain surgery on people, they'll keep them alive or keep them awake. Well, hopefully they keep them alive. They'll keep them awake, and they'll use local anesthesia to cut into the skull and everything. But they'll just keep them awake so that they can probe things and say, "Well, do you feel this? Do you feel that?" And they don't feel pain when they're poking around in their actual brain tissue.
Again, around the brain is where you actually get a headache at, especially like a migraine headache.
Yeah, that's a great question. And that voice is really familiar. It's
Very
weird.
familiar. That sounds familiar.
Do you want to talk about where headache pain comes from?
Doesn't matter. Well, I don't know where you're going. Yeah, you go first, and I'll help you.
Well, there are stretch receptors around the blood vessels that surround the brain, and one of the hypotheses is they don't like to be stretched.
Right.
And when they are stretched, because the blood vessels dilate, the diameter gets larger, they think that they're being ripped apart, and so that's the signal that they're sending to the brain is we are in trouble. Which 1,000 years ago, 200 years ago, it's like, who gives a shit? What are we supposed to do about it?
Exactly. Yeah.
The body's telling you all these signals, and it's like, what are we supposed to do about it? Why did it develop those mechanisms?
Yeah, interesting.
It's almost as if the medicine was in our future, and our bodies developed these mechanisms to signal to us that we need medication or other intervention. It is weird. Think about it.
Yep.
What use does a person 1,000 years ago or 10,000 or 100,000 years ago have with knowing that their blood vessels that are surrounding their brain are dilating? Because they had migraine.
Oh shoot, yeah,
that gives it, and they just gave it weird names like malodorous humor or something like that, and it's like, why?
Yeah.
Why did that develop? It's weird. I understand. Don't put your hand in the fire.
Mm-hmm.
That kind of pain
Makes
fiber
sense, yep.
makes
Right.
sense.
Yep.
Don't walk on thorns. That makes sense. Try to avoid spears going in your back and coming out your front.
Yeah.
But why do we need to know about some of this internal stuff?
Yeah.
Appendix. Appendicitis. Then one shit they could do about it.
No.
All that pain told them was you're going to die.
Yeah. Yes, you got a rotten appendix. And Stacy, we got a question from the gallery.
Yeah, go ahead.
Yeah, from the family, fluid family over here. No, because I was looking all that up today, just trying to get my head to calm down. And I saw something about using saline and salt water because the salt water
will shrink the
right.
Yeah, no, it's bullshit.
Okay. That's what bullshit.
I mean, in the hospital, maybe we could do a saline infusion if someone has brain swelling because they have water intoxication. That there are things like that we can do. But otherwise, what they do with migraines is they give you medication that actually constricts the blood vessels back again so that they're not feeling like they're stretching. The hypothesis of a migraine is you get constriction of the blood vessels surrounding the brain for whatever reason. They're just sensitive to some stimulus, and then they clamp down. And that if they clamp down in the visual cortex, you'll see an aura. and people know it's coming. They see an aura of flashing lights or marquee lights or whatever in their vision. And then after the constriction period, the blood vessels go, oh, geez, the muscles in them are exhausted, and now they will dilate because they can't maintain their normal tone. And as they dilate, blood is still pumping through there, so you get a rhythmic increase and slight decrease of the caliber of the blood vessel, and that causes the pounding migraine headache.
Right.
And then over time, the muscles will tone back up again, the migraine will go away. Yes, Scott.
But can I say this? In cases of vomiting, if you vomit up a lot of fluid, though, you could become dehydrated. So salt water may help. Kind of replenish electrolytes.
Well, if you're vomiting.
If you have electrolyte deficiency, it can help.
I wouldn't take salt tablets, so I would just drink Gatorade or something like that.
Or like you said, go to the hospital and get an IV fluid.
Right, if you're that dehydrated. Yeah. The other thing I was thinking, though, is when you vomit, as we call it down here. Well, I vomit, but when they wouldn't give me credit at the Walmart.
Oh, jeez. Myrtle.
they wouldn't give me credit at the Walmart, don't you know? I vomit all over. Anyway. So,
geez.
It just gives you an image that, hey, ma'am, we don't give, this is Walmart, we don't give credit, as you call it. But anyway, when you vomit, you can increase the pressure into the head and brain, right? And that could cause headaches too. Now, if you get a thunderclap headache after vomiting and it doesn't go away and it's the worst headache. Right, thank you. You can say that into the microphone, DNP Chris. That's an emergency. Get to the hospital. Mm-hmm. Worst headache I've ever had, sudden onset. Just the first time it happens, get it checked. Yes. People have sex headaches. It's a thunderclap headache. It's severe. It's the worst headache they've ever had. It happens suddenly. They need to go get checked. Mm-hmm. Because maybe some of those could be an aneurysm.
Right.
And that's what I thought I was having was an aneurysm.
Yeah.
That's my first default.
I'll tell you, for people who couldn't hear him, Stacy said that he thought that's what he was dealing with. And then, of course, you got on your motorcycle and started driving around, which is the brilliant thing to do.
Great
if
idea.
You're thinking you're having an aneurysm. I stepped off of a curb once and didn't know there was a curb there, and it's amazing. It was 6 inches or something, and just that much jarred my brain. My body wasn't ready for it, and I got a headache in the base of my brain that I thought might be an aneurysm, and I was like, "Oh, I'm going to go eat at Freiberg's."
You dissected your vertebral
That's
arteries.
What I thought. Yeah,
with a jarring, yes.
Yeah, I mean, it was amazing. It is amazing what gravity can do to you if your body isn't ready for it.
Oh, yeah.
What is a cluster headache?
Those are interesting. And cluster headaches, good. Let's see. Uh-oh.
Please tell me it's somebody I can.
It is.
Hello.
Logan Field, you're on Weird Medicine. Now, dude, we're recording.
Oh, you were recording right now?
Yeah, do you have a medical emergency?
Do I have a medical emergency?
Oh, my God, he's high. He's high. Okay, I'll talk to you later. Jesus. Okay. Sorry about that.
Stoned.
Love Logan Field.
Where the fuck was I?
Cluster headaches.
Cluster headaches, yeah. So cluster headaches are interesting in that they come in clusters, hence the name, and they are severe and may be often accompanied by histamine release. So people will have runny nose. Do you have cluster headaches? Is that why you're asking?
No, a friend of mine did. I was curious.
Yeah, and then you can treat them with oxygen, too. Were you going to say something, DMP, Chris, about cluster headaches? Okay, it looked like you were going toward the mic. She just goes toward the mic like she's going to say something just to fuck with me. Mm-hmm. And then I go, yeah, go ahead. And she goes, no.
No.
Does your friend do cocaine?
Oh, that's a question.
No, he does not.
Good.
Good.
Well, good for him. So, but yeah, cluster headaches are different. We treat them a little differently. And people can go for months and months and not have them, and then they'll have boom, 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 just one after another. Mm. And it can be lifestyle changing. So if you have those, see a neurologist. They can help you if your primary care is not versed in treating cluster headaches. However, let me just say this to the medical students and the residents and the physicians and all the other healthcare professionals that listen to this show. Just go to fucking Up to Date. If you have somebody come in with that, you can look it up and you can treat them. You don't have to just refer everybody everywhere.
Right. Yeah.
Good
Not everybody needs a neurologist.
No, they don't.
Gives a neurologist a break.
You can do this stuff. It's right there.
You can
this
do
isn't,
it.
Yeah, this isn't 1992 anymore, where you had to go to the stacks and look up stuff. Okay.
Some of them should.
DNP Caressa, under her breath, was like, maybe they should refer everyone. Yes, but I mean, you can make yourself.
Not because they should learn.
You can make yourself smarter. So anyway, just look it up.
How about how about a little fucking effort? That's all I'm saying.
Exactly.
Just a little,
Yes.
just a little
Just
effort.
put it in.
Just try. Just try.
Yes, please, just a little
Just a
bit of
little
effort.
effort.
It's not exactly a job. It's not just a job.
No.
Actually, you wouldn't believe the number of emails I get saying that my doctor, just blew me off. I had rectal bleeding, and they went, we'll look at it in 6 months, et cetera, et cetera. It's incredible to me. And I just send them back. I'm sorry. Some of my colleagues are just dumbasses. Now, I only get a small fraction of the people who are seeing healthcare professionals, right? So of course, I'm going to get the ones that people are complaining about. But it is a kind of
because the ones that are doing well don't come see us.
That's right.
Yeah, and that's the way I look at it. Every once in a while, I'm like, what in the world? But the good news is there are a lot of folks out there that have great care. So
yes, we have to say that.
We do appreciate that.
And the COVID vaccine is safe and effective and prevents transmission of disease and blah, 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 blah. Thank you, YouTube algorithm. All right. Here's one. This one's just, I labeled it Giant Penis.
Ew.
Oh.
Hey, Dr. Steve. This is Mike from Connecticut.
Hey, Mike.
How are you?
Good, man. How are you?
I'm good.
Good, good. Good, man.
I hope everyone else is well.
Yep.
I called in a couple of weeks ago, and your producer told me to try again. So I'm trying again.
Okay, what he's talking about there is we had this huge backlog of calls that we never got to. So we sent out a thing. I think we had an intern at the time and sent out messages to everybody. Hey, your call never made it to the air. If you want to call back in, feel free. And that's what this is about.
Cool.
So, and by the way, that was 2 years ago. So,
I wondered if you could talk about frightened turtle syndrome, because my pecker, sometimes it hides in itself. I believe that the medical term is called buried penis or hidden penis.
Okay.
And when it does that, sometimes it makes urination difficult because it goes all over the place. And I can get it back out by actually pushing on the base.
Yes.
And it will come back out.
I know exactly what he's talking about.
The fat pad.
Yeah, so he's got hidden penis, and he's right. It's also called buried or concealed penis.
Or shrinkage.
Or the shrinkage.
The shrinkage.
It's the shrinkage. I need to have a drop of that.
Yeah, it is the shrinkage.
George
I was in the pool.
screaming, it's the shrinkage.
Surely she knows what the shrinkage is.
A lot of people have contracted this after COVID as well. There's this thing called COVID dick that I know that people have talked about. And that, I think, is just constriction of the cremaster muscle. Somehow it has increased tone. Don't know why. Inflammation, whatever it was, that is now pulling the scrotum and the penis closer to the body. That's what the cremaster muscle does. And but you can be overweight and have this, and sometimes people just have it because they've got a big pubic fat pad, or that's just how their penis does. And he's exactly right. If you push on the base or on either side of the base at the pubis, you can get the penis to extrude. Normally, hidden penises are average size, and they function exactly the same. It's just the anatomy. And in severe cases, the shaft and the head of the penis may not be visible at all, and I've seen cases like that.
Wow.
Now, Dr. Steve's rule still holds that if you lose 35 pounds, you will gain 1 inch of penis length. Now, Shawn is nodding his head. How many pounds have you lost? Because you used to be quite a bit larger than you are now.
Close to 70 now.
70 pounds.
Yes, sir.
So I would predict that you would have gained 2 inches approximately of visible penis. That's really what we're talking about, isn't it?
Yeah.
Yeah.
That's pretty accurate, yeah.
Okay, good deal.
Well,
Good
there
deal.
you go.
Now, that relationship is only linear for part of the weight scale. If you weigh 900 pounds, right, and you lose 35 pounds, you're still going to be minus 8 inches. You know, it's going to be retracted. So you got to get down to well, or whatever. You got to get down to a certain level.
Well,
At least going back to, we're going back to neutral. We would like to get back to neutral.
Right, you got to get to 0.
Yeah, we gotta,
and then every 35 pounds you'll gain an inch until you get, for 6 or 7 iterations, unless you've got a 14-inch penis. But if you've got a normal size penis, then 5 to 7 iterations of 35, you will gain an inch, and then after that it'll drop off again because you can't get you can't. It doesn't make more penis by losing weight. You're just revealing penis that's actually there. And double vasectomy Todd lost. I think he lost 70 pounds as well, and he confirmed that he gained about 2 inches of apparent length. That's okay. Good deal. So that's what that is. Now, what to do about it? You can see a urologist if you're a normal sized person. You're not overweight. And you have a retracted or buried penis, then the ligaments that are holding the penis up are too short or they are too contracted or whatever, and a urologist could go in there and loosen those up for you. Mm-hmm. It really, I would only bother with it if you're running around naked and you want to have, some showage while you're flaccid. As long as when it's erect, you've got your full aspect, then I wouldn't worry about it.
No.
But if you feel you have an abnormal penis, see a urologist. They're the ones that see that. Okay? All right? I'm looking at a website. It says, how is buried penis treated? Well, very good. It says the treatment depends on the underlying cause. Oh, no. If a buried penis occurs, it's good. Does that not go without saying? Anyway, so detaching the ligament that attaches the base of the penis to the pubic bone, they can do a suction lipectomy or the removal of fat cells. So those are for the people who have the big fat pad, like Dr. Scott said. Abdominoplasty, that's a tummy tuck for people that have the massive paniculus, the big, what we colloquially call a gut hanging down. They can remove that and reveal the majesty of your penis. Mm-hmm. And then I don't even know what in the hell this is. Escuthionectomy. I've never seen this word before. DNP Carissa, have you ever seen this? ESCUTTHEONECTONMY. It's like escuthionectomy, or the removal of fat pad above the pubic area. We'll just say that. Suction lipectomy. I guess they do it by cutting it rather than suctioning it out.
Well, I guess if there's enough of it.
Yeah.
That'd be a hell of a lot of fat.
Yeah, really. Skin grafts to cover areas of the penis where skin coverage is lacking. Rude. Buried penis repair where sutures are attached internally to the base of the penis. Okay, so what they're doing there is they're attaching sutures to the base to keep it from retracting. It's just like, oh no, you're not going back in that hole. It's pretty cool. All right. And then it says medications. Well, a doctor may prescribe drugs if buried penis has caused an infection in the genital region. So there's not a pill for this other than, Viagra or sildenafil, something like that. All right? Interesting. Very good question.
Very good question.
I hope you get that treated. All right. We've got time for a few more. Got anything from the fluid family?
Hey, Dr. Steve.
In fact, we do, and it kind of goes right along with the subject.
Okay, well, let's do that one, and then we'll do this one.
Diesel Child. he's got a good question here. Are there any medications or supplements that will decrease the efficacy of tadalafil?
Oh, in other words, are there drug interactions?
Right. So things you don't want to take if you're taking Cialis or Viagra. There are a couple things.
Okay.
Number one, I'd be cautious.
Alcohol.
Alcohol.
Yeah.
Aspirin, blood thinners can sometimes be a little bit of a problem if your blood's too thin. Certainly, if you're on antidepressants, those can
Correct.
cause,
but yeah.
maybe in blood pressure medications.
If you're taking nitroglycerin, you cannot take PDE5 inhibitors, Cialis, Viagra, Levitra, that stuff. That can cause a fatal drop in blood pressure. So I know that there are drug interactions, but things that reduce its efficacy. Well, of course, the things that cause people to be put on these things in the first place. Any drug that can cause erectile dysfunction, like, as Dr. Scott said, the antidepressants, the selective serotonin inhibitors like Viagra, like Prozac or Zoloft, Paxil, those.
The old school ones.
A lot of people get put on these drugs because those are causing erectile dysfunction or sexual dysfunction of some sort. So if you're taking Viagra and then you get put on those, yes, those could affect it. I'll have to look and see. There's some.
Hey, we have our special guest has something to say.
Yeah. Go ahead.
What about Sudafed? Isn't that what they give you to get?
Yes. Okay. All right. You're going to get a bell.
Nice.
Give thyself a bell.
Oh, hellfire!
If you go into the emergency room
Lucky guess.
with priapism,
yep.
which is an erection lasting more than 4 hours, they will give you pseudoephedrine. What was that? What did you say? No, what'd you say? It's a radio show.
I just asked if it was a guess or a personal history.
Oh, yeah.
Opie, when he was sick one time, you were talking to him. You all were doing a joint show, and he was complaining about whiskey dick. And you asked him if he was on Sudafed, and he said yes.
You remembered that? Wow.
Nice.
I actually pay attention to this show sometimes.
Yeah, I know. It's amazing. People, it is amazing. There are people who have gone through medical school have emailed us saying, hey, thanks for the medical information. I sounded smart on rounds because I listened to your stupid show. So I think that's pretty awesome. But anyway, all right. Well, listen, thanks, Dr. Scott. Thank you, Tacey, for Tacey's topics. You okay over there?
Yeah.
And say, okay, all right. Thanks, Shawn, for being with us, DNP Carissa and Stacy DeLoach. It was awesome to see all of you all. And, until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Real smooth, dog. All right, very good. All right. We had this question here. Let's go ahead and do it. And, that was fun.
That was a good one, yeah.
Okay. All right, let's do this one. Okay, before we go, we had started this question, and I'm not sure what it is, so let's see here.
Hey, Dr. Steve. I've been listening for a while since my husband got me hooked on your show.
Oh, husband. Okay, never mind. So anyway, thanks for listening, everyone. No, I'm just kidding. Sorry. I'm being an asshole.
But calling for the first time.
Excellent.
So I have a question about allergies. I'm a 38-year-old, and I have been a long-time allergy sufferer. Pretty much my whole.
Twice, actually.
We did?
We did this last week too.
Oh,
yes,
yeah. And 3 weeks ago, yeah.
Go get the
Well, that's because you're an idiot.
Probably because it was a girl, and I decided to keep it in here. Okay, all right. Well, how about this question?
He'll be coming down from Jersey when he comes. He'll be coming.
All right. Do you have anything else from the Fluid family?
No, that'll wrap her up. I think take us out of here with going around.
Oh, you want to?
Let's do it.
We can do that.
Sean,
okay.
Sean P's here. He's
okay.
Coming
down from Jersey when he comes.
There you go.
Don't forget Dr. Scott's website at simplyherbals.net. And check out our Patreon. Why would you? Patreon.com/weirdmedicine. Thanks always go to Dr. Scott. Thanks, Tacey. Thanks, Shawn, for coming. And DNP Carissa, thank you very much for your contributions. And Stacy DeLoach. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners. This is insane.
Awesome.
Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine.
He'll be bringing Boardwalk Fun Girls. He'll be bringing Bug on Fun Worlds. He'll be bringing Boardwalk Fun Girls when he comes. That good old Shawn, he surely is he's a good fella. I'll tell you that. He surely is, and that's a fact.
Oh, that's classic.
Fabulous.
Okay, now let's do the opening. Turn the air conditioning on.
Intro time, baby.
Yep, do the fuck.
Intro.
Damn it.
Uh-oh. That's not good.
Stacy.
Damn it,
What the
Stacy.
hell did I not do? Sit back and play your guitar.
Hey, man. Where's that sax?
Oh, I got the sax.
Where's it?
I was told that the sax. Oh shit, we're still recording. I was told that the sax has got a bad pad. I need to take it, but we'll get it out. So I didn't buy any new reeds, but I think he's got some unused reeds in there. And so we're gonna do Into the Mystic with.
Oh yeah.
Oh no.
Sounds good, Shawn. Shawn, if you can just can you find
snore.
a G on that thing anywhere or a C?
I can.
Anywhere?
Those I can do, yeah.
If you can just find that, you're golden.
Yeah, we just do. We'll just do 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 do. All right, let me erase these.
Erase?
Re-race these.
Okay.
Okay.
What else you have to do?
Laundry.
Laundry?
Oh.
Yeah.
No. Did we do Traveler's Diary?
You got it.
She's coming home tomorrow.
Props to Tacey. We did that, right? Did we ever do that? Where the guy who said...
Mm-hmm.
Okay, we did that one. Ghrelin and Hunger. Ozempic, we did all these. Oh, shit. Nitrogen hypoxia. Punch to the liver, hydrogen peroxide gargle. Shit.
The punch to liver doesn't ring a bell.
It does not?
That
Okay.
doesn't sound
Okay.
familiar.
Shawn would eat.
Well, Shawn
He
pays
knows
more,
better than we do.
Shawn pays more attention than Tacey and I together, I'm pretty sure. No offense,
And I
Tacey,
don't
of
even
course.
really
Yeah.
exist. I'm just here.
Are we on? Why?
Yeah,
We are?
We were, yeah. Oh, yeah. There's Mark Browning. Hey, Mark.
Oh, okay. Are you sure?
I think so.
Okay,
Steve.
I see
Yeah.
it. I see it. Okay,
Yeah, I
all
think
right,
so.
all right. Somehow I'm. Okay. All right. You ready to do the intro
Yeah.
and then we'll play some tunes. Then we'll go fuck off. All right. Here we go.
One, 2, 3, 4, 5, 6, 7, 8, 9, 10.
If you just read the bio for Dr. Steve,
What do you call an angry coach? A cross trainer. Why did the turkey cross the road? Because it was playing chicken. I decided to sell my vacuum cleaner. It was just gathering dust. What did the cat say when it answered the phone? Can you hear meow?
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103, and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valves, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve.
Dr. Steve, you'll take a cow for to the vertebrae.
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio. Now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider, gives me street cred with the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things, Tacey. Hello, Tacey.
Hello.
We have in the studio Shawn P. from New Jersey. Hello, Shawn.
Hello.
We'll talk about him in a minute. And DNP Carissa back from sabbatical. Hello, DNP Carissa.
Hi.
And from the swampland of Louisiana, it's Stacy Deloach, everyone. Hello. This is a show for people who never listen to a medical show on the radio or the internet. If you have a question you're embarrassed to take your regular medical provider, if you can't find an answer anywhere else, give us a call, 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. All right, very good. Don't forget stuff.drsteve.com. That's stuff.drsteve.com for all of your online shopping needs. Check out the Roadie Coach. Now, DNP Carissa is learning how to play the ukulele using the Roadie Coach. So she's going to come in 2 weeks from now and play a song that we'll play it all together in 2 weeks.
2 weeks.
That she will have learned from the Roadie Coach.
I can't wait.
Is it somewhere over the rainbow, or is it going to be something like that?
One of the songs that she can play that is with the chords that she knows is that Harry Styles song, As It Was or whatever. You know that one?
No.
Okay, well, anyway, it only has three. It
It's
only has
amazing.
4 chords.
That's amazing.
And I looked at the chord chart that she brought to work, and it's like, well, hell, you could play that Harry Styles song.
Oh, wow.
I'll play You Are My Sunshine.
There you go. That's what I want to hear.
Nice. Okay. All right. Well, you can do that too. But I think it'd be, just to show how. Anyway, so we'll see. Cloud. But check it out at roadie.drsteve.com. Roadie, R-O-D. No, that's wrong. ROADIE.drsteve.com. And check out Dr. Scott's website at simplyherbals.net. We'll talk about that in a minute. Tacey and I do Patreon, patreon.com/weirdmedicine. We are sadly behind on doing those.
Yes, we are.
And Felicia Gillespie has been asking to be on the show, and so we're going to try to have her on. Maybe we'll do that tomorrow as a live stream, and maybe we'll have Shawn here for that, or maybe we'll do the live stream later this evening after everyone's all liquored up. We'll just, by God, see. So we'll do a drinking show. But patreon.com/weirdmedicine. And then...
I couldn't make words with the last one of those.
It was funny, though. And then cameo.com/weirdmedicine. We're going to do a cameo here in a minute because we have somebody that wanted one. So we're gonna go offline after the show and do a quick cameo for them. But anyway, cameo.com/weirdmedicine. Now, Shawn, do you want to plug your business at all?
No, that's okay.
No? You sure?
Nope.
Shawn, if you've seen the the video on youtube.com/@weirdmedicine. The banner behind me was done in Shawn's studio, and it's amazing. He made it for DabbleCon, and then we just put it up in the studio because it's too great not to just display constantly. So anyway, thank you for that.
My pleasure.
All right. Okey-doke. There you go.
There you go.
Excellent.
And yeah, and let me save this real quick so that we don't lose it. I'm saving everything in the cloud now.
Ooh.
Oh yeah, I'm highfalutin.
Fancy.
I was giving a talk to.
Okay.
I was giving a talk to the residents, and I said, I said something about we do something in real life, and
Richard
went,
Kish said hello.
Oh yeah.
Hey, Kish, tell me so nice.
I know Kush. I thought he said, "What's?" Because I was wondering where Shawn was, so I saw him on TV. Nice. Oh, Kush.
All right. Let's see.
Are we doing a? Do you need us for the?
Patreon live stream? Well, I think we'll just do it later.
No.
If we feel like it.
No, the.
Intro, no. It's done.
No, the.
Cameo.
Oh yeah. Let's do that. Let's do that. Weird Medicine. What's the date today?
8/12/23.
For a broadcast.
8/19/23.
Okay. All right. Good deal. All right. Let's get the cameo going.
It's fun.
Will you play chords in the background? It'll be funnier.
Oh yeah, you can make fun of me. That's
Yeah, no,
fine.
it'll be hilarious. Just play like "You Are My Sunshine" or something.
Oh yeah, just play like I don't know what the fuck I'm doing. Sure.
I love that one.
Yeah, I like that one. That's
That's so cute.
Let's see here. Requests. I know I have a request. Where are you? Oh, let me hook up. Let me connect to the internet. That would help. Now, if they want Myrtle, I got to put the.
No, you don't.
You don't have to do nothing.
No, you don't need to.
Nobody tells you to. You don't have to do nothing.
Yes, I do. I has to do everything.
If it's green, does that mean it's in key?
Yeah.
That's cool.
It is cool, isn't it? What's cooler, though, is you having a robot tune it for you. Okay, question for Joe. I'm 53. Oh, I've been told I have cataracts, but insurance won't pay for my surgery. Oh, eye doctor offered clear lens exchange, but super expensive. Sick of glasses, it's a lot of money. 53. Why won't insurance pay for his surgery?
That is strange.
That's okay. So he's
Very
implying
strange.
he has surgery. It's typically covered.
That's what I
Yeah.
thought. Yeah. It's kind of strange.
It's medically necessary.
What
Okay,
he
it's
needs
got
to-
to be deemed medically necessary. That's the thing.
They just have to rewrite the letter.
Uh-huh. That's it. Okay, well, let's do it, and then we'll do fun, too.
Okay.
All right? Are you guys tuned up?
I'm good.
Yeah.
So what are you going to play? Because what I'm going to do is I'm going to answer this question and then go, take it away. 3, 2, 1, and then you guys, what are you going to play?
I'm gonna play.
Oh boy.
Inagata
Okay.
Davida.
Inagata Davida. All right, but maybe we don't have to play a song with this guy.
Yeah,
we'll just
wait
say
till next
hello.
time. We'll wait till next time.
All right.
I'm never coming back around these parts.
Oh,
How
shit.
much do I say that? Every week.
Every week.
And it sounds country as hell too. Hello, Joe. It's your old pal, Dr. Steve from Weird Medicine. I understand you're 53 and you've been told you have cataracts, but insurance won't pay for it. Insurance will pay for it if it's medically necessary. So that's the key. What do they consider medically necessary? So you have to have some deficit in your vision or night vision. Hey, I'm a driver, and now I've got these halos around the street lights and I can't see it, so I'm unsafe. If you pose it as a safety risk or as a safety issue, you'll almost always get it paid for. So I think that don't pay cash. See if you can get your insurance to pay for it, okay? And if you can't, email me. I'll send you my email address through Cameo, and we can talk kind of back and forth about what they're putting on the prior approval that's keeping you from getting these things approved. Now, as I do that, everyone here wants to say hello. We're in the Weird Medicine studio. Oh, look at this guy. You ever wonder what Stacy DeLoach looks like? Well, now you, by God, know. And there's Dr. Scott and Tacy and DNP Carissa and Shawnee P. Are you guys going to play a song for him?
Let's play one.
Okay, play a song.
Well, he'll be coming round the mountain when he comes.
No, don't play.
Oh, God.
All right, I guess we're not. Well, that's actually not that bad.
That's pretty good.
You know, don't stop.
Oh, that's it.
All right, Joe, let us know how your eyes do. Get your insurance company to quit screwing around and pay for your cataracts. All right, man. Hope you have a great weekend filled with fluids and secretions, but those unaffected by human pathogens. How about that? All right, thanks, man. See ya.
Hello, Chuck.
All right, what are we going to play?
I'm getting the hell out of here.
Are you?
Yeah.
Oh.
Don't worry, I'm coming with you.
Oh. Shit on both of us.
Shit onions. You might have to help her, Shawn.
I think it's
She's
to your
purring.
left.
She ain't real
I
sharp.
think it's to your left. Go forward. Look down. Is it right around there somewhere? It might be behind some stuff, so I'll come get it if you guys can't find it.
Hard.
Well, no, it's soft.
What was it?
Did you find it?
I believe so.
Yep. Thank you, honey.
I didn't do anything. Do you want this to see it? Stop.
What? Huh? What?
Did you want this to see it?
No. No.
Scott,
What, sweetie?
this is the roadie.
Cool.
Roadie coach.
Cool,
He's
man.
teaching me how to do nothing.
Do nothing well.
And I'll continue to do nothing.
I'm sorry your headphones didn't work.
It's fine. I didn't talk anyways.
Well, because your headphones didn't work. You want to do Bertha?
Yeah, we could do birthday, and then we'll give a shot to
Yep.
to Into the Mystic.
Yeah. I love Into the Mystic.
I'm all for it.
Okay. What are you plugged in or are you
No, it's-
miking?
Miking, yeah. Can you hear me? Can you hear me now? Can
Yeah,
you hear me
let's see.
now?
Let me see.
There you go. That's better. There you go.
Now I'm going downstairs with Taze.
Thank you, honey. Very cute.
I just like to listen to you.
Hang on, you go. I had a hard run. running from your window. I'm running, wondering if you care. I had a running down. Run around the corner, oh, ran smack into a tree. I had to move, really had to move. That's why, if you please, I am on my bended knees. Bertha, don't you come around here anymore. I dressed myself in green, went down to the sea, tried to see what's going down, going down, tried to read between the lines. Had a feeling I was falling. I turned around to see. Heard the voices calling, Lord, you were coming after me. I had to move, really had to move. That's why, if you please, I am on my bended knees. Bertha, don't you come around here anymore. Ran into a rainstorm, ducked back into a bar door. All night pouring down, but not a drop on me. Test me, test me, test me, test me, test me, test me. Why don't you arrest me? Throw me under the jailhouse, Lord, until that sun goes down. I had to move, really had to move. That's why, if you please, I am on my bended knees. Bertha, don't you come around here anymore. 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 Oh, we had to marry it. I cut you short, Steve. I cut him off. There you go. Oh, we have noise.
Yeah, I thought we did it.
Hey, that sounds like noise.
We didn't do retordando at the end. We just go all the way through.
Yeah, I
do that.
Anymore. No, I did that. Yeah.
I know.
Oh yeah. Anymore. 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 There you go.
That one.
Yeah, that's better. That's better.
That's the way we practiced it.
Yeah, yeah.
What do you want me to do with that? Oh, it does smell terrible.
That actually sounds like it's, you know what you're doing.
Oh yeah.
Oh wow.
Give us a song that you know, then we'll play it.
No, if he could just, if you just play can you play a C? Hang on. Yeah. Can you play a G-ish?
Well, E flat is a C, right?
Yeah.
So play an E flat.
E flat. Well, that's good.
Oh, really? That's an A.
What?
That's a C. That's a D sharp.
That's good. No, all you need is a C and a G. That's really. Yeah.
Well, no, he needs to be able to do.
Is that a tenor saxophone? I don't know how to transpose.
Anyway, helps if I spell mystic right.
We were born before the wind, also younger than the sun. Ere the bonnet was one, sailed into the mystic. Hark now, hear the sailors cry. Smell the sea and feel the sky. Let your soul and spirit fly as we sail into the mystic. When the foghorn blows, I will be coming home. When the foghorn blows, I want to hear it. I don't have to hear it, and I want to rock your gypsy soul. Just like way back in the days of old. Magnificently we will fold into the mystic.
Do, 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 do.
There you go. So back to E minor. When that foghorn blows, you'll be coming home. When that foghorn blows, I want to hear it. I don't have to fear it, and I want to rock your gypsy soul. Just like way back in the days of old. Together we will fall into the mystic.
Okay, can you play it?
No.
You found it?
No. I haven't found it.
That's okay.
I have the sax notes here. Hang on.
Ooh,
Yeah, I
that
found
smells
the tenor
nice.
sax, but they're
Smells nice, huh?
tenor sax and
Now, how do you take it?
Oh, okay.
132nd.
Because it's in tenor.
Dip it in there.
The tenor sax part.
Yeah, it is. It's low, but you could still.
Put it in the,
I don't know how to transpose it, especially on the fly like that. It's been
Just
such a
that
long
little.
Well,
it's a
we can
teeny
play it
amount,
in
huh?
the key that you can play it in, and we'll just change keys. It's the easiest fuck song to play.
Yeah, it looks like Rosin, yeah. Sean, buddy, it's not going to matter. What I sing it in, it's going to be terrible anyway. That's pretty wild.
So if you can find the music and just play it transposed, we'll transpose to you.
I'll try it later. I'll get some water in a minute. Try it.
All right. So what can you do?
Nothing. I can
Nothing. Hang on.
No, thank you.
Yeah, I'll try it later. I'll try that.
It doesn't smell that bad.
No, I like it. I actually like the smell.
Yeah,
I'll try it. I'll try it. I'll try it when we get downstairs. How about now?
What about how about a reggae or something? So you can play. Anything. Can you play blues scale? Can you play a blues scale? Yes, you can. You just played one. You just played a blues scale.
You just played it. You just played something.
What key was that in? Play it again.
Play it again. Keep doing it. Keep fiddling. Just fiddle. And fiddle slow. Yeah, fiddle slow. Fiddle slow.
Here we go. Here, that note right there. Play that note.
It's not even in tune.
Hang on.
How the hell you tune those things up? That's interesting.
Move the fully valve, reset it out.
I had no idea.
Okay, hang on.
Oh no, hold that note right there.
B flat. That's B flat. So
B.
okay, that's okay. We're gonna play B flat blues, and you're gonna play in G, in your version of G. Okay. There you go. There you go. If Scott would shut the fuck up, you'd actually be playing something. Play B. It's in B flat.
I'll play a B flat, fucker. I'll just play B flat.
Here, play a B flat. Let me hear a B flat. Okay, play that scale.
That's what I was playing.
Okay, ready? 1, 2, 1, 2, 3, 4.
There you go. No, you're good. That sounds good. Don't stop. Don't stop.
And after this verse, then Scott, you sing.
Gotcha.
There you go, Scott.
Thrill is gone. Thrill has gone away. You can play, yeah. Don't bother me. Thrill is gone now, baby. Thrill has gone away. Someday I'll move on, and you'll be sorry someday. Everything that happens, you know I am to blame. Everything that happens, know I am to blame. Someday I'll wake up and be home, baby, just like a good man should. Play it, brother. Play, please.
Yay.
There you go. Shawn, I like him playing that sax. Yeah. We'll put him in the band. He's in the band.
Yeah.
You're in the band, dude.
Definitely good enough.
Oh, fuck yeah. Hell, he's better than I'll ever be. He plays once every 20 years, and he's better than I am. That's not saying much for me.
Be longer than 20 years.
Amanda, what's up?
Hey, there's Amanda.
Well, Amanda.
Did you make Amanda moderator on our channel?
No, I did not.
I didn't either. Who's doing that? Yes, you did.
Well, for fuck's sake, I don't know how to do any of this. If you
I'm
tell
glad
me,
you are,
I don't know
Amanda.
how to do it.
I would have made you a moderator, Amanda.
I would like to take credit for it, but I really can't.
Critic?
Critic.
That's what you do at Jazzonomics.
That's right.
Man, that. I love that saxophone, dude. You're in the fucking band, man. You're in the band.
Whose horn is this?
It's probably one of his
That's
kids.
Liam's.
Liam's, yeah.
It's a nice horn.
That's Yamaha, standard sort of high school.
They make good horns.
Yep.
I'm pretty sure he doesn't buy anything that's not pretty
No, I
high
didn't.
end, yeah.
No, I buy shitty stuff.
Shit.
Really? You seen the same radio stuff? Get shitty.
Don't do that. Don't do that.
It's not 10 ticks like I had.
Don't antagonize him.
I bought what he has too. So
Don't prod the bear. Don't stick the bear.
I brought
Thanks, Kush. Thanks, Kush.
really, really nice trauma kit.
Oh yeah, really? Oh really?
Nice. Really nice.
Cool, man. Kush.
Amanda says, "Don't lose Shawn in the woods." Is she coming to Detroit?
Yeah, I think so.
Yeah, cool.
Yeah.
All right, get the band back together again.
I hope she is.
Me too. We should sing one. We should sing "Coming Round the Mountain" to Amanda. Hang on, let me open recent. Where's good old Shawn, the band version?
Tell you what I'm falling in love with is Dead South.
Oh, they got some good stuff, don't they? Yeah, they have some real good stuff.
Oh, there it is. Here we are.
Back out on tour.
Yeah. We're going to have some really good bands coming
Here we go.
soon. Rhythm and Roots. Here we go. Here we go.
Well, she can't hear it, though. What can we say about Amanda?
She's
There's
in Denver.
nobody listening.
Well,
Oh, I
first,
know.
She's in Denver, so she'll be bringing
Oh,
some-
yeah. What should she be bringing? Some kush?
Kush.
She'll be bringing some kush.
and some edibles when she comes.
What else can she be bringing from Denver?
Wax. Oil.
Well, all right. Enough with the...
The THC references.
You need to go back down to your little study place, Houston.
So she bring in some wax. What? What's that good?
Some gummies and
some dab.
Some dab.
Should be bringing some
Earls,
bringing
some
dab,
Earls, and some
dab
Earls.
and
Some Earl.
wax when she comes. Okay, what else they have in Denver? What's Denver known for, huh?
Oh, shit.
Denver's known for.
She's coming from a mile high place.
She is mile high. She is a mile high. Yeah.
Crazy airport.
What?
A crazy airport.
Mile High Airport.
Coors, the Coors beer.
Is that from Denver?
Yep.
Should be bringing bags of Coors Light. Should be bringing dab and wax vapes when she comes. Okay. Okay, bags of Coors Light. What else?
How about kegs of Coors Light?
Kegs of Coors
Kegs
Light.
of
Okay,
Coors
yeah,
Light.
that's better. It's got to be 4 syllables.
Yeah, kegs.
Okay. And
Um,
one more.
How about bucking some of them Denver Broncos?
Should be bringing.
Should be bucking Denver Broncos. She's coming out of the Rockies. Yeah. She's bucking Denver Broncos.
Okay.
I think that's a football team or something. You can improvise over that.
You think it's a football team?
No, I know it's a football team, but
okay.
Myrtle does.
I see. Oh, yeah.
Myrtle does.
Yes. I got it. Okay. Duh. I'm just like, damn, dude. I know you're a hippie, but. All right, here we go.
I'm also a former athlete.
I know.
Former.
I'm aware. Okay, here we go. Okay, we'll record it, then we'll play it for a minute.
Cool.
Okay. Okay. Nope.
She'll be bringing dab and wax vapes when she comes.
Oh, wait. I have to say coming around the mountain first, don't
Yeah.
we? Yeah, okay.
There's a 4 up here.
Yeah.
She'll be coming around the mountain when she comes. Good old Amanda. She'll be coming around the mountain when she comes. She'll be coming around the mountain. We sure looking forward to seeing her, 'cause she's a good, and I'll tell you that. Well, she'll be bringing dab and wax vapes when she comes. She'll be bringing dab and wax vapes when she tried to say that a couple of times real fast. Wax vapes and wax vapes, and they have it's legal there from what I hear. Well, she'll be bringing kegs of Coors Light when she comes. She'll be bringing kegs of Coors Light when she comes. You hear that, stuttering John? She'll be bringing kegs of Coors Light, bringing kegs of Coors Light. He likes his Coors Light, he surely does. She'll be bucking Denver Broncos when she comes. She'll be bucking Denver Broncos when she comes. Don't rightly know what that means. Is that are you making me say something dirty, Dr. Scott? Well, I can't wait to see her, Rail. She's a good, and she surely is. Good old Amanda. I can't wait to see her coming up here in the. Well, I guess we're seeing her in Detroit. Ain't the same thing. Well, thank you. Okay.
All right, now. Hang on. So stupid.
God, that's the best. That was
and
great.
We will. I hope she's still here.
She is, yeah.
Okay, Amanda. I've got to move it over to the other computer.
Oh my God, that's funny.
Amanda.
Too much.
When she comes, CUMS. Okay, Sirius XM Exchange. Okay, I don't know how the mix is going to be on this. It's going to be terrible, but it's all right.
It's going to be fabulous.
All right, now let's go to Sirius XM Exchange. It's such a complicated process to get something from there to here. Here we go. There she is, Amanda when she comes.
Amanda.
Okay, ready? Uh-oh. Come on now.
Come on now, help.
Oh, there it is.
She'll be coming around the mountain when she comes. Good old Amanda. She'll be coming around the mountain when she comes. She'll be coming around the mountain. We sure looking forward to seeing her, 'cause she's a good, and I'll tell you that. Well, she'll be bringing dab and wax vapes when she comes. She'll be bringing dab and wax vapes when she try to say that a couple of times real fast. Wax vapes and wax vapes, and they have it's legal there from what I hear. Well, she'll be bringing kegs of Coors Light when she comes. She'll be bringing kegs of Coors Light when she comes. You hear that, stuttering John? She'll be bringing kegs of Coors Light, bringing kegs of Coors Light. He likes his Coors Light, he surely does. She'll be bucking Denver Broncos when she comes. She'll be bucking Denver Broncos when she comes. Don't rightly know what that means. Are you making me say something dirty, Dr. Scott? Well, I can't wait to see her, Rail. She's a good, and she surely is. Good old Amanda. I can't wait to see her coming up here in the. Well, I guess we're seeing her in Detroit. Ain't the same thing. Well, thank you.
Oh my God.
You're leaving?
That is great.
Oh, really?
Yeah.
I'll go back to
Yucky.
I know.
You gonna come back?
To what?
No. All right. Yeah, you can listen to it.
God. That is funny. That is funny. Did Amanda hear that?
I don't know. I wasn't.
Yeah.
On YouTube.
Yeah.
I hope so.
Her.
No, I was for real.
Tell her. You can tell her you. Tell her you're talking.
Oh, yes, you did. That's crazy.
Isn't that great?
That's
Yep.
crazy.
That's a hell of a damn song, I tell you. Good God. Who would have ever thought? Isn't that great? Oh, goodness sakes.
I've never had a song for me. That's right.
Yeah, you have.
Don't worry, we're gonna make one for you.
Yep. Good old Carissa, she's a good. And then we did that song. She surely is a good. That's all Myrtle knows how to say. She surely is a good. And he surely is a good.
All right. Well, I didn't want to leave without telling you bye. So,
Hmm.
yeah.
You gonna come back or what are you doing?
Well, what are y'all doing for?
We have no idea. But yeah, so just stay in touch then. And we'll figure something out. We might just sit out back and cook something or order out.
There's severe thunderstorms.
What?
Until 8 p.m.
Okay, well.
They're not out there yet. Be careful.
I guess I need to get on the roof and try to outrun them.
Where you headed, Stacey?
Don't know.
Oh, Amanda said, we are also known for mid-century architecture. Well, that would have been great in that song. Why, she'll be bringing or what? What is it? Oh, she'll be bringing mid-century architecture when she comes. Hey, I'll call you. Carissa. Jesus.
Hey, you.
I'll call you, honey. She's a good. All right.
I'm on the road.
Are you really? Oh my God.
Yep.
Go stay over to Meadowview.
Gotta go right. Oh, yeah.
Let's go to the Meadowview. You and Shawn can mow up.
I actually don't mind riding in the rain, but that's just me. I was actually supposed to be doing a.
It ain't you. It's
Thanks, everybody. I think Amanda and Diesel.
Where you have to be next week?
I got to fly to Seattle.
Okay, Diesel, yeah, you're absolutely welcome.
Yeah. That job's done. Cut my check for about 3 million. I'm out of here.
Let's go. I'm gonna. Hang on. I just wait till I see that thing turn.